Hello, Milton. Thank you for doing this. It's going to be a little bit weird because the two of us are Brazilian, Portuguese speakers, but we are going to record in English. But I know that the work that you're doing is so interesting that the word has to be spread in a language that more people will understand. So, can we start with where you were born and where you are today, and maybe some story that connect the two things?
Thanks, Mauro, for this. It's a great pleasure to be here, and it's an amazing opportunity to discuss a little bit of my work. Actually, I'm born and raised in Rio de Janeiro, Brazil, especially in a neighborhood called Tijuca, where well, I mean, you can leave this neighborhood, but the neighborhood never leaves you. So it's one of those places that I mean, as a middle class kind of community, and I was early in the 80s when I was a teenager, listening to rock and roll. I had a school band and played sports, and I was actually triggered by the genetic engineering at that time, and I thought, well, this is the kind of thing that I'm willing to do in the future. And I decided to study biology. I went to the public university, a federal university in Rio, where we met actually, and it was a wonderful experience because biology, the biological sciences community is highly diverse, different from more other courses such as law or medicine or business. So it's highly diverse. You have people from different parts of the city, different parts of the country, and it was very rich. I was at that time. It was in the late 80s, and I mean, we were at that time in the first steps of our early democracy. I mean, we had the first election in 1984, and then I mean 1989 I was going to the university and get involved in field politics and I was head of the that time of the community and the institute, the students community, and that was a very nice experience. We had different experiences there, and that also helped me grow as a student and then as a professional. So then I made my master's and my PhD. My master's at the university, the Federal University, and then moved to institute, the Public Health Institute, where I'm working until today, which is called Oswaldo Cruz Foundation, and is dedicated to public health. So that was also a very good environment to work with and study with neglected diseases, applying the all of the technologies and the very interesting techniques that I learned in the university. So I was then a molecular biologist, and I started to study immunology and genetics of infectious diseases, especially leprosy. So I started to work trying to develop new tools to diagnostics and prevention of that diseases. So that was a very interesting period of my life where I mean I was basically understanding a little better the pathogenesis of this disease. It's important to mention that it is one of those diseases where it's a neglected disease and affects most of the vulnerable populations in Brazil and also in the world. In Brazil, we still have 30,000 new cases every year. So it's a public health issue, and we don't have, for example, early detection techniques or methods, and we don't have a very effective vaccine. And so we started to study how we could improve the diagnostic methods. And around 2003, we started to develop a new PCR, at that time real-time PCR, the detection assay to try to increase the sensitivity and the specificity to leprosy, and
And you did all that living in Rio.
yeah, yeah. Basically in Rio, obviously I mean, as scientists, we have a lot of cooperations. At that time, we had a nice cooperation with a group in Baton Rouge, Louisiana, United States, and who was also studying. They were also studying the the some diagnostic tests, and also leprosy for a long time. It's a national Hansen's program in U.S. And that was also very important because helped train some of our students at that time, PhD students, and speed up the development of our products. So that was 2003. We started that. It was a master thesis that I supervised, the first one actually, and it took us actually. Around 15 years until we got to a product, a GMP product, actually a good manufacturing practice test that for leprosy that is now is validated and registered at the Brazilian FDA. We call Anvisa. So it was a very long way. It's important to mention that actually I became in this past few years also head of leprosy laboratory, which is a laboratory where we develop a basic science projects, but also, I mean, we have a clinic, we have an outpatient unit. So we see patients and we treat, diagnose them properly. So it's one place where we actually do translational research and clinical research. So we try to improve the diagnostics and the treatment, the quality of life of our patients. And that's the main reason why we are doing this, because these population actually needs it.
Okay, I want to go back a little bit to the location question, because I believe this is important, right? So you are telling us that most basically your whole career, which is a career in which you went from a science interested high school student to the head of uh, the laboratory that is fighting one of the most, let's say, historical
Biblical.
diseases, right, that afflicts humanity since biblical times, and doing translational research that goes from the understanding the molecular mechanisms of the disease to the treatment and to the development of diagnostic treatment and development of a vaccine. But you are doing all this in a country that, maybe I'm going to turn this even into a question. Do you believe our country is dedicated to science? Because when you think of Brazil, you not necessarily think high level biotechnology, high level development of cures to disease, but you are giving us an example of a scientist that has developed his road most of his career in Brazil, actually in Rio, and is having accomplishments. It's accomplishing results that are going to be of importance to the whole world in, like we said, very important disease for humanity. How is this local component? How does would your life be easier if you were outside Brazil? Would your life be uh, um, with the accomplishments that you have? How the locality or the local components impacts those accomplishments?
Well, I mean, this is a great question, Mauro. Thanks for asking, because it helps me also to give some context, right? I mean, obviously there are some components in this. First is that Oswaldo Cruz Foundation is actually a public health institution dedicated to solve public health issues since its foundation. I mean, our founding father, Oswaldo Cruz, in 1900 actually fought yellow fever outbreaks and plague and different kinds of diseases, infectious diseases at that time, trying to improve all the conditions and the quality of life of people, and also introducing vaccination. At that time, it was a huge breakthrough, technological breakthrough, right? And it was, I mean, this is the kind of, I mean, they were actually developing, basic science, but trying to, to solve public health issues. So, I mean, the history and the tradition of our institution also helped me to focus on the most important things, which is not only published papers, right? I mean, we need to go right beyond these publications, and that was very important since the beginning. Obviously, that being in Brazil, we have difficulties, and but we also have some very interesting components, because you have the challenges to do for example, these developments, and especially for to develop a diagnostic kit or a vaccine. I mean, you actually need good manufacturing practices. I mean, you cannot just have in-house solutions to with reagents that you can. I mean, you cannot have quality control of that. So, so it's again. I mean, it was very interesting that I was in an institution who is a huge producer of those reagents. I mean, the good manufacturing practice reagents. So it was they were available, so we could just combine the development that I was doing for the past 10 years with this new facility that is producing reagents for molecular biology. And then we got this new composition and mixtures that actually is now the assay that we developed. So it was obviously that maybe I didn't have the funding, the necessary funding to develop as early as I could. Obviously, I mean, we could do that in a few years back. if I had proper funding, right? So if I was in another country where I could secure funding for to develop, that would be easier. But I mean, I cannot complain. I believe that, I mean, we are doing better now than we are in a few years ago. So I believe that. And I mean, I had difficulties, but now, I mean, we are preparing our structure in our translational research laboratory also to perform clinical research. So, along with this diagnostic test, we do have, for example, an artificial intelligence algorithm that we are going to use photographs and clinical information to suspect leprosy. So I could take a photo and fill a form with some information, clinical information of the patient, and then I could suspect leprosy, and we have the sensibility, very high sensitivity of around 90%. So this is really important. And the other things that we are going to perform the first clinical trial in an endemic country for a recombinant vaccine for leprosy. So this is the kind of thing that we are able to do, being in an institution like Oswaldo Cruz Foundation.
And you just said like we are better now than we were in the past. So this, I'm going to use this quote to for my next question. Like, so do you think the world is getting better or it's getting worse?
Oh, it's getting better. I mean, if you take all you know, the data concerning, for example, children and mothers and women mortality, it's decreasing. It's decreasing everywhere since the 60s. We have the improvement of vaccination, and that decreased most of the children's mortality, especially for infectious diseases and diseases transmitted by water, for example. So obviously that um, we can see, I mean, some, you know, uh, back and forth movements, right? I mean, it's just like waves, right? I mean, we were a little better in Brazil a few years ago concerning the poverty, especially the extreme poverty, and now we are moving backwards, and that's really sad. But and then I mean, and we still need to solve a lot of issues concerning the inequities that we have, not only in Brazil but also in the world. And I think, but I think that we are moving forward, and we are getting better. We still need to solve, uh, issues like climate change and and the poverty, the extreme poverty, and this will going to be the biggest challenges that we have for the future. How we handle our waste, and but anyways, we are getting better.
And okay, the next question is like maybe you already mentioned. So, what are the challenges that you see ahead for the world to continue to improve? You mentioned inequalities, you mentioned the environment, and particularly waste. So, how do you see and poverty, right? So, like things are a little bit connected: poverty with inequality and waste as being one component of the environment. You said even climate change, and in my perspective, poverty is extremely related to that. But how do you see? So, do you think these are the main challenges, or something else comes to your mind?
Well, I mean, obviously that now we have to consider pandemics, right? I mean, and this is, I mean, obviously that this all of this things that we are discussing concerning the environment, the poverty, handling well the waste, forest preservations, and management of water, sanitation. These are very important, but obviously this impacts a lot the circulation of new viruses or new bacteria, and obviously this is not only those that are hidden in the forest that were hidden in other mammals, and then that could reach us, could reach humans. It's not only that. For example, 2050, we expect that we're gonna have 10 million people dying of resistant bacteria, right? So this is very and the point is that we do not develop new antibiotics for the past 30, 40 years. I mean, we do have some new combinations, but it's very expensive to develop, and it's highly it's difficult that companies actually invest in these developments because they're not very lucrative. So this is a kind of issue that we do have to deal with. And the other things that, for example, if we're discussing public health issues, we are improving a lot the technology associated solutions for health, right? So we have image analysis, we have new algorithms, we have new diagnostic kits, and they are assays that that requires a lot of technology, and that's also a problem of funding, right? Because we need investments to give access to all the population these new solutions. We do have now very important drugs for cancer or for different kinds of diseases that are not accessible at all. And this is going to be a huge problem because we're still gonna have inequities in the whole population. So we have to face those issues immediately.
Okay. I don't want to put you on the spot, but I have a tricky question for you. Okay, because you just said we have problems that require solutions that are risky to develop, right? And those risky developments, well, because they are risky, somehow they require a lot of funding. But the problems are not. Do you think the problems that we need to address are equally well characterized? Okay, because like what are the risky associated with the problems? So the risk of the next pandemic, the risk of resistance to antibiotic crisis, the risk of climate change, the risk of not getting vaccinated for COVID. So, as a scientist, do you think all these risks are the same? They are, and 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 how? Well, at first, do you think those risks are the same or not?
No, they're not the same, and they're very difficult to estimate, and that's the point, right? Because I mean, there's so many variables to consider, and that could impact a lot the way that actually we handle and we manage and invest in priorities. That's the point, right? And but the point is that we do need what we are calling now the preparedness, right? I mean, we need to anticipate all of these discussions and try at least to figure out what is going to be the next pandemic. I mean, we had MERS, we had SARS, and now we had SARS-CoV, and I mean, obviously that we now I guess now we are more prepared to handle any new pandemics because we do have messenger RNA vaccines which are easy to develop and proved very effective, right? So maybe we're gonna have better tools to fight new viruses and new pandemics. But we need try to estimate a little bit better what are the priorities and how to invest it. But it's a it's not a it's actually tricky because it's not an easy question.
Yes, and I was reading an interesting article the other day talking about okay, this is not those questions are not for the scientists to answer, right? So, like the scientists have the role of informing, but ultimately are the politicians or the society if we come up with better tools for us, better governance tools, right, for the society to express their will, um, to decide. So, my next question will try to connect those challenges with your professional choices, right? Because we just talked about the future challenges, and you identified, fighting new pandemics with fighting new pandemics as a challenge, but at the same time we're still living and dealing with biblical diseases and with historical, like how do we say that in English, millennials or millennial disease, like disease that still for millennia. um, do you see a connection between the two things? So, like, how do you navigate those two priorities, like fixing historical challenges and preparing for the new ones?
Yeah, that's also a very interesting point. I mean, it's one of those difficult. I mean, I believe that some solutions, I mean, can actually help solving a lot of public health issues. For example, I mean, obviously, if you decrease poverty, and we do have a lot of experience in Brazil concerning that. I mean, the cash transfer voucher, they're called Bolsa Familia, which is um, government funded program for the extreme poverty population. I mean, decreased children's mortality. So, and we know that comparing the coverage in different municipalities, right? So, the point is that we do have now, I mean, possibilities to make investments and solve issues that are gonna maybe make the word a little bit easier, and then we could move trying to uh, I mean, because obviously, if you decrease poverty, it's very likely that I mean we're gonna reduce, for example, the incidence of neglected diseases such as leprosy or tuberculosis or leishmaniasis or schistosomiasis, right? So, I mean, these are things that we actually need to fight in an integrated way, and then then we can focus on the next challenges, I guess. But I mean, obviously, that sometimes we gonna be hit by a new virus and a new pandemics, and just as what we are experiencing now, we have to stop everything that we are doing and focus on this new virus. I hope that we don't have any other virus actually circulating in the next 100 years. But obviously, uh, this is I mean this is very unlikely, right? I mean we are having outbreaks. More often, every 10 years, we have a new virus circulating. So it's going. We are going to have a new one in the next 10 years. That's for sure.
Yes, it's when we talk about reducing poverty, the thing that strikes me the most is it's so doable. It's actually not difficult to do. It's not like how can we uh, start using solar energy for everything? We don't know, and it's a huge challenge. We need to invent things that don't exist, like understand concepts that we don't understand. The same thing if we want, I don't know, to colonize Mars, but to end poverty, to end hunger. These are it's even cheap to do. Like, we know how to do. The technology is not new. It's just a matter of mm, decision, right? So, and why those decisions are so difficult. But at the same time, like we said, if we look 100 years back, poverty was 99% higher, right? So we are probably on the way. Could be faster, but hopefully we will end this thing soon. While you were talking, I was imagining that maybe the same tools can help. Going back to the public health
Vaccine.
issues, the same tools can help us fight both the future problems and the past ones, right?
Sure.
Because if we those RNA vaccines, they are in the end a platform that will be easier uh, um, to not personalize but adequate the target more easier. And if you are in between pandemics, we can use these resources to go back and think and fix these old problems. So
Yeah,
maybe tell
yeah.
us a little bit about. Okay, and
No, no, no. This is
comment,
very
please.
important to mention because I mean, neither RNA vaccines or, for example, new editing, uh, um, methods for genome analysis such as CRISPR are very popular and very cheap, right? So, I mean, you could handle cancer and infectious diseases at the same time. So, I mean, actually, I mean, we are spreading these technologies now, and obviously we the same technology that we are using for COVID, we're gonna be using for we could be using for leprosy, for leishmaniasis, for TB, tuberculosis, and other neglected diseases. So and we could also apply to different types of cancer, and obviously we're gonna need some investment. But the point is that I mean, we now know that these vaccines are very effective, and they're remarkable, right? So they're very it's a great breakthrough in the history of molecular biology and medicine, and as CRISPR, right? So we can actually fix some of genetic disorders and embryos. So this is amazing, right? This is obviously an issue for the future, but I mean that's going to be possible, and it's very I mean, although it's challenging, we're gonna do that, and that's going to be available. I mean, for everyone, and we hope actually for everyone, right?
How so the way you were saying, like, that those things are integrated, you can I say that you are expecting these improvements to be somehow exponential, right? That's what I'm getting. Because once if it works for this and it works for that, then boom, it works for a lot of things, and it will be easier and easier to solve these historical problems. And when I say easier, also requiring less and less funding, hopefully. And then you get uh, um, you get this exponential improving in life quality, hopefully longevity. How do you see the what a country like Brazil needs to 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 keep up with this exponential growth? Or and maybe the question can be extended not only to Brazil but to the developing countries. You have said that we, at least in Oswaldo Cruz Foundation, we do have all the infrastructure that has been built for over a century to develop vaccines, to produce vaccines. And because of that, we can, like, definitely, because we were involved in the production of other vaccines, I guess polio and some others, Brazil became one of the producers of COVID vaccines, right? And because of that, even with all the challenges that we had facing the pandemic, we managed to very fast vaccinate most of our population, or a big part of our population, while some other countries more developed than Brazil, because they didn't have this ability to produce the vaccines, or had difficulty to get the vaccines and to fight the pandemic in the most efficient way. So looking at this exponential improvement, the scenario of the world improving exponentially in regard to public health, what should we do to keep up with this exponential growth, to be part of it, not to be excluded?
You're right, Mauro. We are now, and we have a very good opportunity here, because we do have I mean, you know, big vaccine producers such as Fiocruz and Butantan, but we still need to build around those institutions what we call the complex industry health, right? I mean, for development, and which are small companies, private companies, or public companies that actually will produce some of the reagents, some of the equipments that actually are going to be used in the production for vaccines or diagnostic kits, or other devices that we need for medicine in the future, right? So the point is that since we do have a very good public health and universal health system in Brazil, uh, they gonna acquire most of those vaccines, of those diagnostic kits. So I mean, if you do have a private company that actually is willing to develop one of a specific component for the production of vaccine, that would be very important, because it's going to be cheaper being produced in Brazil than, import from India or China. So that's the kind of development there is still need, and obviously a push from the government is very important at this stage, right? I mean, some investments from development banks, and that would help a lot. New startups and companies that could, I mean, be very important in the future to actually make this exponential growth. And I believe that you're right. I mean, that's the point. I mean, in a few years, we could actually produce vaccines for different kinds of diseases, and that will decrease the poverty at all by itself, right? And obviously that if we solve the waste and water management and sanitation problem, that would be better, and improve a little bit income for the poor people. That is um, going to improve the quality, improve education, and that will be, as I mentioned, a great opportunity to growth for Brazilian growth.
so this one of the things that I was thinking while you were talking is how this exponential growth can help the how can fixing the problem in one area can release the resources from that area to fight another problem, right? So let's say if we solve some of the the public health issues that are consuming limited, resources, financial resources, then with vaccines that we now can produce, and in the end are going to be cheap, it's a much cheaper way to fight those issues, right? Preventing other than treating. Then you release the funds that can go, I don't know, to bring sewage treatment to everyone, bringing treated water to everyone, and then again you have an exponential improvement in quality of life. So Milton, how do you see other people that are listening to us? What are the challenges that you have on the things that you are doing that other people could help, and how they can reach out to you?
Yeah, that's a very good question, also. And the point is that actually, I mean, if we are now, I guess as we were discussing in the past few minutes, we have a great opportunity here because we actually have the tools to solve public health issues. They are available, right? And then now we do have the diagnostic kit that we developed in here in Oswaldo Cruz Foundation. We have the vaccine trial. And we're going to run what we call phase 1B, 2A, but a clinical trial, it's an expensive, right? And because we do have to test if the vaccine is actually effective. And the point is that sometimes it's not lucrative at all, because obviously part of this, and depending on the public and the and it's a little bit limited depending on the number of patients and their families, the family members that is going to benefit from vaccination. So we actually need specific funding for those clinical trials to test whether those vaccines are going to be effective or not. And once obviously it's we clinical trials are expensive, and then but then this is the kind of help that we see, that is going um, to
Be
to
needed.
assist and to aid the development of and to accelerate the development of those kits. The other thing obviously is to actually the reach of those new technologies, right? For example, a diagnostic test, we need good infrastructure with equipment and well trained people. So it's not accessible everywhere. So I mean, sometimes if you it's not only the development of the kit and the registration of it. This is the first phase, right? I mean, the other things that we need uh, to make it accessible, and it's also a lot of investments in that, yeah, because it involves a lot of training, a lot of. But anyways, I mean, these are obviously the public system already have some infrastructure that will allow the introduction of this tests. But I mean, if we could grant access to more vulnerable populations, we need to amplify the number of sites that is going to perform these. And again, this is needs a lot of investment. So this is the kind of help that we would need in the future.
Okay, and while you're saying, I'm seeing exactly this, the complex of public health working in the system that you mentioned, because both the clinical trials. So you're still in you have developed the kit, but you still need to make it more accessible to the patients at, let's say, point of care, right? To bring it to point of care in to these vulnerable populations, and also in the development of the vaccine. You could do those things maybe in two ways. One would be because it's a neglected disease with not such a prospect of profitability. So it could be subsidized during the development, like with grants and things like this. But the government could be because there are all these externalities, right? All these hidden benefits in terms of contributing even to the reduction of poverty itself. So it would be in the interest of the government that these diseases are extinguished. So the government, yes, they could subsidize the development, but they could also work as a kind of beta client, right? Paying a higher price for these treatments or these cures, and that would stimulate the whole supply chain of development of these solutions. It would be a beautiful example on how the government as a client with the interest of reducing poverty and improving the quality of life of the population, how they could work not from maybe just one traditional model of funding and development, which is grants, but also working, okay, I'm the client, and I'm willing to pay the premium, let's say the difference, increase to turn this, to pay whatever is necessary for this product to be financially viable, if someone is willing to develop it, and then you create traction, you create demand, right? And it's somehow how other technologies have been developed in the world, in other countries. So maybe a different model,
Yeah.
but a very effective one also.
Yeah. I mean, obviously, we would need some health economic analysis on that, but I would say that it's probably cheaper, right? This kind of investment would be cheaper than diagnose the patient and treat them later, and depending on the disease, we have high morbidity rates, right? I mean, the patient can have incapacities, and that I mean restricts the work, the labor capacity of those individuals, and that's I mean how I mean it's highly costly these this kind of diseases, right? And I believe that I mean we can get to that.
Great. Milton, three final rapid fire questions before I let you go. The first one is, what is the book that you are reading right now?
I'm reading the, I guess it's English, it's The Codifier from Walter Isaacson. It's actually the history of Jennifer Doudna, who is the one of the Nobel laureates for the CRISPR analysis. A great,
Yes,
great book.
I have to put this in my list. A lot of people are talking about this book. The second one is about lifestyle. Do you take long or short lunch breaks?
Well, I like uh, long breaks for lunch. I enjoy some time and good talks, and some of those lunches actually we are discussing science and discussing work, and they are highly productive, especially when we also drink some wine.
Yes, well, I don't know how to translate what Domenico De Masi calls the creative osium, or right, are these moments in between leisure and study that they become highly productive. And because you are my personal friend, I know the two of us enjoy these moments a lot. So the last question is Bitcoin. Are you a believer or a non-believer?
I am a believer, but I'm still a beginner, so I don't understand actually very well the technology. But I believe that's the future. I believe that we, especially for example in science, we need a one of those systems to exchange, and that would be easier to trade. Goods and reagents and everything. So we do need these kind of financing system, right? I believe this is the future. But quite frankly, I'm not. I'm still a beginner. I
Yeah,
still need to
you
get
know,
in.
like one of the things that, of course, uh, digital money can bring all sorts of functionalities, right? Like you said, it allow easier crowdfunding and done funding, a lot of practical things that can make the life of a scientist easier. But the book that I'm reading right now is called The Price of Future, and it talks about how the importance of deflation in guaranteeing a future of abundance, right? And one of the problems that I believe we have in science, it's what it's called short time preference. So we need results fast, and that creates a kind of vicious incentive for us to maybe jump to conclusions, or work with preliminary data and everything. Why? Because the world of inflation, you have a very short time preference. Things need to happen right now because they are going to get devaluated or debased in time. If you move to a system that allows deflation, so the price of things, they reduce over time, then you can be comfortable with a long time preference, right? And you are okay to take the time to get to the proper conclusions, to get to the proper answers, because you don't have this pressure of things losing value over time. So this is an unseen consequence, I believe, to scientists of the use of these new technologies that allow for deflation, like Bitcoin. But I'm sure we'll have more time to talk about this over our long lunch breaks. Uh, where should we? What is the channel that you prefer for people to get in touch with you? Is it Twitter? Is it LinkedIn? Is it email?
It's a mail. You can mail me Milton.Moraes at theocruz.br.
Yeah, we're going to put this on the comments. Milton, thank you so much,
Thank
and see you
you.
next time.
Great. Thank you.